Thank you, I appreciate that. And now, bringing it all together, a visual demonstration to help bring medical jurisprudence and medical ethics to a fine point. Two silks, two red silks, which represent the pain and discomfort that can be felt from a legal proceeding, which we tie these two together into a knot, and then, if I may I ask you please to hold your hands out for me? Thank you. I'm going to set the tied silks into your hand and just have you close your hands. And just hold on to those so I can't get anything into your hands. There's no silks in. Just relax with it, okay? I don't want you to get a muscle cramp or spasm. And I brought a detergent box with me, my box of splash detergent, and this is going to help to illustrate what our legal system helps to serve. We open the box and we notice that we have 3 soiled silks. The first soiled silk reminds us we want to be very careful. We want to avoid any type of breach of duty for our patients. We don't want to sully our reputation as clinicians and physicians. We want to be certain to obtain informed consent when appropriate, which is whenever we are prescribing, engaging in a procedure, or intervening to treat a patient. We must explain potential risks, side effects, as well as potential med-med interactions, and give the benefits for the patient to make an informed decision. We want to avoid failure to obtain informed consent. Remember, we talked about ethical breaches of having inappropriate relations with our patients. An ethical breach results in a loss of license. We talked about all of those other potential inappropriate behaviors as a clinician and physician. Abandonment, we want to avoid abandonment. Failure to obtain informed consent. We talked about all of those inappropriate behaviors we want to avoid. We put those soiled silks into the detergent box. We may think of this as our fabric softener. However, keep in mind, this is our knowledge of appropriate medical practice. This is and represents our understanding of medical ethics and medical jurisprudence. This helps to protect us. We close the box. We gather moisture from the air, we shake the box, incorporating all our knowledge into our practices and in preparation for the exam, the final exam on medical jurisprudence and medical ethics. And when we open the box, what do we find? 1, clean silk, free from all of the stain of inappropriate practice. A second clean silk, free from the stain of inappropriate practice. Our third clean silk, free from the stain of inappropriate practice. And then, of course, hopefully, there is nothing else lingering. However, we want to recapture and be certain that we have all of the knowledge that we've gathered in this course to be able to use it when the time comes on the exam. In your hands the whole time have been the 2 red silks that we tied in a knot, placed into your hands. In a moment, I'm going to count from 1 to 3, and when I reach this and speak to number 3, I'll ask you just to open your hands, if that's okay. And so now I'm going to go 1, 2, 3, and we've recaptured all our knowledge of medical jurisprudence and medical ethics. Thank you very much. Thank you all. Please have a great weekend. And it's been a real honor to be here with you. Thank you. Thank you.